Hey guys, just running in the cornfield. Pretty cool, huh? All right, let's go see what Dr. Wyatt has to say.
I'm going to talk to you about airway and breathing, and that has a lot to do with the shape of your teeth, the shape of your face, the shape of your mouth, and everything about you. It has a lot to do. It's more important than people think. Breathing correctly is a very important thing. Now we're going to have 4 different videos on airway, and you will need to listen to all of them. Okay, the first thing is what keeps the air out of the body. It's things that doesn't allow you to actually breathe and pull the air in properly. And so there's several things that can happen to you that keep you from breathing right. One of them, you can have oversized adenoid tissue. That's a tissue that grows down in the back of your throat back here, and it can go down and just darn near close the airway, and so then you have to breathe through your mouth. Or you can have your children or you can have oversized tonsils. Though in adults they usually diminish in size as you get older, but you can have tonsils, and I've seen kids with tonsils so doggone big that they actually touch in the back of their mouth. So you'll have 2 different sizes. They'll have tonsils that touch will be called four different sizes. That'll be a number 4, and then if they've got a little gap in between them, that'll be a number 3, and then a number 2, and a number 1, and then just a normal tonsil doesn't come in contact. Now you can have a lot of different things in there, like a deviated septum, like this little bone right in the middle of your nose going up here, can be bent or pushed over to the side, and it'll block one side of your nose, and it'll give you a lot of trouble. You can't breathe good with a badly deviated septum. You have some problems. Then in your nose, you have 3 turbinates on each side of your nose that protrude out into the nasal cavity, which are coated or covered with these little fine cilia that the body keeps moist all the time. And as you breathe air in, they collect the dirt and the crud and the allergic material and stuff like that that's in the air, and much of it is caught on those cilia, and then it kind of comes off in your nose, and you breathe it down, and it comes in your throat, and you swallow it frequently. Well, this stuff doesn't bother your stomach. Your acid in your stomach will kill it. But if it gets in your lungs, it makes a big difference, you see. So you need to have this cilia functioning in your nose, and it's on your turbinates. But the time the turbinates get so doggone big that they themselves block the airway to some extent. Now, the lady worked for me for years, and she had oversized turbinates, and she could never breathe properly. So finally we talked to one of the ENT guys that came and lectured in our programs, and he went in and took, her name was Pam Durant, and she had these turbinates reduced in size where she could breathe good, and that was very important. You can also have polyps, or just little growths in the mouth. This is pretty rare and not a big problem for us to have these things. And that's not a big deal. The big problem with not being able to breathe is allergy. And we get so much crud and things that we are allergic to, and I'm allergic to things. I mean, I have a lot of allergies to dog hair and different things that I live out here, and all these cedar trees and the cedars and things that I may be allergic, but I'm allergic to a lot of things, and I have an airway problem, and I have to watch what I do, and I'm going to cover what the things that we do. Now, there are these things that obstruct the air from coming in, and people who are mouth breathers actually have their tongue in the bottom part of their mouth, and they breathe over their tongue, and their tongue doesn't go up in the roof of their mouth and keep the roof of the mouth spread out. So you'll see somebody who's a chronic mouth breather will be run around with a little narrow palate rather than having the palatal structure in a nice oval shape in here that holds the size of the tongue. They'll have a little narrow palate like this, and that causes a reduction in the airway size for the air going into your lungs. You cut it down that way. Now, these things that block the air are bad for us, and if we have them bad, then you need to do something about that, surgically or otherwise, where we could go in and separate the palate orthodontically, and that's one of the best things that you can do orthodontically. Now, there are a lot of other things that come in, that the problem with the air we're taking in, that we can do to solve that. But we're going to try to cover most all of this in these 4 videos on air and airway. Airway thing is something that every parent should know.